Hi there, I'm Shelly Paulson, and I want to take this time to let you know a little bit more about my journey and why I'm so excited to be part of RADECT Health. I've always been a part of some sort of athletics. My family was into sports of all kinds, and wellness has always been part of my experience. I played a lot of youth sports with volleyball, basketball, running and track, and it was a high school injury, an ankle injury to be specific, where I spent a lot of time with an athletic trainer that put me on the path to healthcare. And somehow I ended up in physical therapy school in Minnesota, and I have had a great career in physical therapy. I've always loved working with patients on their rehab journeys, restoring function, teaching exercises. It's been a huge part of where I've been, and I've loved it. It has actually been my running experience that brought me to yoga. About 15 years ago, I was training for Twin Cities Marathon, and I injured myself. I was piriformis syndrome, pulled a hamstring muscle, ended up with low back pain, plantar fasciitis in both feet. It was kind of a mess for a while. Didn't think I'd ever run again. I didn't think I'd for sure be running that marathon that year. When a friend told me I should try yoga. And I thought, well, what if I got to lose? I'll try it. Ended up working with a great practitioner, and she was able to get me back to running form. No pills, no medical intervention, changing the way I looked at healthcare, basically starting from inside out. So I was doing a lot of meditation, breath work, focusing on my energy, along with the physical rehab and exercise component that I've always known. It was just an added bonus. I was looking at nutrition, I was looking at sleep habits across the board, and focusing on all of the other things. The physical got better. I was able to run that year and many more marathons afterwards. That experience changed my life, and it changed the way I work with my patients. Eventually, that interest took me to seminars, including yoga and Pilates for rehab specialists, which then led me to therapeutic yoga teacher training. And so I have been teaching yoga for 2 years, but it's been a lot longer than that I have used all those principles with my patients. It changed the way I was looking at wellness. And after 20 years as a PT, I recently have started to shift my focus from restoration and rehab to prevention. And I think we can do a lot more for our patients and clients if we are taking into account the whole person. I think our current healthcare system doesn't encourage wellness in that way. It more looks to treat symptoms after we've had an injury or after there is a problem, versus looking at our risk factors and what our potential is to develop chronic diseases. And I think that's a disservice. So I am very excited to be part of RADECT Health, because that is their whole system is based on treating the whole person and looking at all these different aspects, from daily habits, lifestyle practices, interests, what do people like to do, what can make fitness and health fun and interesting for that individual. So I am part of a comprehensive team where we look at members and come up with these individual plans, but we look at it from all these different perspectives. So I think that's the best way to treat the person. Today's healthcare professionals, we aren't always allowed to do that. In the outpatient world, everything is so specialized. So my hope in working with RADECT Health clients is to help each person reach their wellness goals and live healthy, balanced lives.